Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Hello, everyone, and welcome to the Oncology Revolution. My name is Raquel Maris, and I will be the host today. I'm an occupational therapist and project coordinator at the European School of Lifestyle Oncology. Today's guest is Dani Binnington, a well-being advocate and founder of the Menopause and Cancer, the UK's only non-profit dedicated to supporting women through menopause after cancer. She is the author of the Navigating Menopause After Cancer book and the host of the amazing podcast called the Menopause and Cancer Podcast. So if you haven't listened to it, go and find the podcast to see the episodes. And through her work, Dani helps women understand their options, rebuild confidence, and find hope in life after treatment. Dani, thank you so much for being here. It's such a pleasure to have you.
Thank you so much for having me. I can't wait to dive in.
So let's start at the beginning. What inspired you to work supporting women through menopause after cancer? And I know there is a personal story here, so I will let you take over.
Yeah, absolutely. So as you say, I was diagnosed with breast cancer at the age of 33. And then afterwards, my doctors told me that I was also carrying a genetic mutation. Many people will know it, the Angelina Jolie gene. So the BRCA genetic mutation, which can increase your risks of ovarian and breast cancer. Because I already had the breast cancer and the grueling cancer treatment, when I was young in my early 30s, I wanted to do everything to reduce my risks. So I had a double mastectomy to reduce my risks of more breast cancers. And then later, I also removed my ovaries. And that surgical removal of my ovaries, I knew was going to make me menopausal way before my age. And at that time, so for anyone in Portugal or across the world to imagine, we had like a menopause revolution going on in the UK. We had celebrities and doctors and amazing people campaigning in the streets of London and everywhere to talk about menopause more. And I kept thinking, hang on a minute, my doctors are saying it's only a small operation, it's only keyhole surgery, and I'll be in and out of the hospital within the same day if everything goes well. No one was telling me about the impact of surgically onset menopause. I had to learn it off social media and on off the television. And so my own quest to try and understand more about how I could manage menopause after cancer then led me to set up the podcast, my first Facebook group, and then really within a couple of years, I realized I needed to do much more because there is so much information that needs to happen, so much learning. People need so much more support, and that's when I founded Menopause and Cancer, and we're now a not-for-profit organization.
Oh, that's such amazing to hear. Well, I'm so sorry to learn about your past and your journey. I can imagine it felt so overwhelming, not only navigating through cancer, but also facing menopause so early. But you have turned it into such an inspiring journey. When you first went through treatment and you felt these first symptoms, did you imagine that one day you will be helping others navigate this part of survivorship?
Absolutely not. And actually, for the first at least 5 years from when I was first diagnosed, the first 5 years of my recovery, I didn't have anything to do with like the cancer scene. I didn't share about it on social media. I had 3 really young children when I was undergoing cancer treatment. My twins were 2 and my eldest daughter was 4. And I just wanted to really fit in. So I wore my wig all the time. I never showed my bald head. I just didn't want anyone's self-pity, really. I didn't want people to feel bad for me. So I just got on with life as good as I could. And I just wanted to be normal, like all the other mums on the school gate. And so it was all about recovery. My mental health recovered much slower than my physical health. I had a lot of anxiety for a long time. Every ache and pain was my worry of a cancer recurrence. I had no idea the menopause would become such a long-term impact for me at that stage. But it was only when I really did a little bit more research about how do I manage my early menopause. Other people were telling me they had breast cancer or ovarian cancer or other cancers, and they too were put into the menopause because of their cancer treatments, that I was learning so much. I was like, Oh, wow. All these cancer treatments like chemo, radio, surgery, anti-hormone therapy, all of those cancer treatments can make people menopausal. And it's going to happen to me. And so many others tell me that they've had no support. That's the first time when I knew I wanted to actively not just figure out what I can do, but also help others understand what their options were. But it was a long time after my first diagnosis. And I think I was quite outraged at first at how little information there is. And the fact that it almost affects all people with ovaries who've undergone some of these types of cancer treatments. It was kind of like mind blowing to think most females with ovaries are affected by menopause after cancer treatment. And at the moment, there is very, very little support and no one talks about it. And it was that realization that really made me outraged at first. And then a little bit, I found my raw and I wanted to just do better. But initially, it definitely wasn't on my radar at all.
But you have done an amazing work. You have been doing an amazing work. So, congratulations on everything that you have been doing. So, let's dive into the menopause itself. And as you said, that you just wanted to be normal, you didn't want to speak about anything. And this is something that many people still don't talk about. So, can you walk us through what happens when menopause is triggered by cancer treatment?
Yeah, and I'll actually, if I can, take a step back and talk about natural perimenopause and menopause, and then how is it different as a result of cancer treatment. So, natural menopause is just like a moment in a person's life, and it's when a person with ovaries hasn't had a period for a whole year. So, it's something we kind of like get diagnosed in retrospect with. And up until that date, people are in perimenopause, and that can go on for up to 10 years. And from sort of people's 40s up to the age of 51, people's hormone levels start to decline, but they go on a roller coaster decline. So it's not like a steady decline over years. It's kind of like up and down and up and down. And that can come with a lot of symptoms like anxiety, depression, low mood, hot sweats, night flushes, insomnia, joint ache, burning tongue, tinnitus, migraines, weight gain, restless legs, all of the GSM symptoms, a genital urinary syndrome of menopause, so vaginal dryness, pain, irritation upon intercourse, thrush leg symptoms, all of those symptoms are to do with that hormonal decline in a person's life. But that can take a long time and it can be really challenging for people. Now, when cancer treatments, like I said earlier, come and muddle into your life, that can come at any age. So, the most important thing here to say is menopause after cancer can happen to teenagers, people in their 20s, 30s, 40s, and people in their 50s, 60s, and 70s. So, it can happen at any age and after any type of cancer. So, anyone listening to this thinking, am I working with cancer patients? What type of cancer have they had? Have they had chemo? Have they had radiation to the pelvis? Have they had surgery to remove the ovaries as well? And maybe they're on anti-hormone therapy for like breast cancers and some gynecological cancers. When that happens, it happens a lot quicker than that natural perimenopause transition. Surgery from one moment to the next, I had none of my hormones and I was only 39. Radiation to the pelvis, it can be a really quick decline when people lose their hormone levels and all of their sex hormones. And for someone even undergoing chemotherapy, that can wipe out all of the ovarian store there is, sometimes over weeks. So it's a much quicker menopause transition that can happen at any age. And because it's much quicker, your body has much less time to adjust to it. So these symptoms I mentioned before can feel a lot more severe. And if you think at a time when someone's had a cancer diagnosis, your world is turned upside down anyway. So your mental health will suffer to varying degrees. People might feel anxious anyway about what does this mean for me? What does this mean for my life? And then the decreased hormone levels can also increase your anxiety. So symptoms may feel a lot worse and are compounded. When people go through active cancer treatment, they're usually quite confused because they really don't know what's what. Is it my chemotherapy? Is it the menopause? Often people then find us as an organization months or years after their active cancer treatment, and they're still scratching their head thinking, oh my gosh, I thought my symptoms would improve. I thought they're to do with the cancer treatment, but now I'm starting to wonder, is it maybe the menopause and what can I do about it? So there is a real difference between treatment-induced menopause or natural menopause transition. And even for people who have gone through menopause and then they've had cancer and cancer treatment, many of these people could be breast cancer survivors, for example, and then they're given a medication, an endocrine therapy that makes them extra menopausal. It's like menopause on steroids. And so even if you've been through the menopause naturally, that can come with more severe symptoms for people in their 50s, 60s, and 70s. So it's a difficult menopause transition, and it's different to a natural menopause transition.
It's striking how rarely this side of survivorship is discussed, and maybe many people still don't talk about menopause openly, like the usual menopause. So it's so important to create more spaces to speak about this during cancer treatment or survivorship. So, what do you think? How can clinicians create safer spaces for these conversations when patients are already passing through this?
Yeah, that's such a great question. And I think the answer is at the moment, there is no perfect answer. And I think everyone who is listening to this conversation comes from it from a different angle. You might be affected and muddling through menopause symptoms yourself after cancer, or being in an oncology setting and supporting someone through their active cancer treatment. When is the right time? What we know from patients and what patients want is better preparation. So we know a lot of people said, no one said it was going to happen to me. They removed my ovaries, they gave me these medications for 10 years, and no one said it was going to give me either symptoms or where to go to for help. So we need to prepare people better. That's the first thing. The second thing is to acknowledge that this can be a difficult menopause experience. So often patients, and I know that from myself, we think, wow, I've survived cancer. I don't want to feel like I'm still moaning or complaining. I'm so grateful I've survived cancer. And so we don't want to bring it up as patients sometimes because we want to move on as well. But we want to acknowledge for everyone this can be difficult. And the third thing is then to provide some support. And I think that is often where the problem is. Currently in the UK, there is no hormonal health woven into cancer programs or any cancer sort of therapies. And so no one talks about it. The problem we then have is, where do we refer people to? Are there menopause specialists? Are there gynecologists? What can the general practitioner do for us? And I don't think everyone in someone's medical team needs to suddenly become a menopause expert. That would be unrealistic and it would cost us billions. But it's important to recognize that the majority, and up to 90% of people over 40, will go through temporary menopause because of cancer treatment. Now, if you think there are millions of people that in Portugal alone will be going through cancer treatment, we're talking about a huge number that will be affected. So if someone in an oncology team could skill up, it doesn't need to be everyone, one person to become almost like the team's menopause champion, I think that would be a great start. It could be a clinical nurse specialist. It could be a physiotherapist, because in a lot of physical programs with exercise and diet, people talk about survivorship and long-term side effects. So it could be in a setting like that. It could be that oncologists start to prepare people better and give patients a lifeline. And they might be saying, actually, if you struggle with X, Y, and Z symptom, do go back and see such member of our team in 6 months' time or in a year. And if it's on some people's radar, and if we drip feed the information to people, then patients have a chance to digest it at a time that feels right for them, and then maybe know where to go to for help. But I don't think there is a perfect answer. Every oncology setting is different. I think at the moment, people in cancer teams don't talk about it sometimes because they've got nowhere to send their patients to. And so they keep the lid on. But what we want to do is we want to lift the lid, see if there is a menopause champion in someone's team who wants to learn a bit more. Can we send someone on a course, for example, to learn a bit more? And I think that would be a great starting point.
I love that idea of creating a champion in the team that knows more about a specific topic. I think that could really help, and it's actually very easy to implement. So I hope more and more teams are listening to this podcast and having this idea implemented on their teams. Now, one of the most confusing areas for women after cancer is hormone therapy. There is so much conflicting information about whether hormone therapy is safe or whether it's not. How do you help women make sense of their options in a clear and balanced way?
Yeah, I think it's important to say that's a big myth. And because there is no nugget of hormonal healthcare within cancer services, it's something that just gets a little bit lost and forgotten. But after most types of cancer, hormone replacement therapy is very safe. I'll give you a few examples. We have a young group of cancer survivors. They're in their 20s and 30s. Many of them would have had leukemia, blood cancers. They might have had stem cell transplants, and that would have made them menopausal. People after bowel cancers, people with brain tumors, for example. Hormone replacement therapy in most of these cancers is very safe. And the first line treatment option if someone is young, because we also know with premature menopause, so before the age of 40, that can come with health risks for your bones, brain, and heart health for when people age. So we need to help people age well, and we need to help them with their symptoms. So there are many types of cancer where hormone replacement therapy, whether that's systemic or local, vaginal, is very safe. Now, after some types of cancer, these will include breast cancers and some gynecological cancers. Hormone replacement therapy is not the first line treatment options, but the NICE guidance says clearly it can be discussed if all other options for menopausal symptoms have been explored and nothing works, and if quality of life is a concern. And so it's never a no-no, it's always a conversation. What we need to also really differentiate for people where HRT, hormone replacement therapy, isn't the first line treatment option. It's not just hormones is everything and it's all the same. They're different. So hormones that go into your whole body, hormone replacement therapy is different to local vaginal estrogen. And so even if perhaps people have had a breast cancer in the past, they've completed their treatment, local estrogen is very safe for them. And many are walking around with debilitating GSM symptoms like the pain in their vagina, dry, sometimes bleeding upon intercourse, the dryness of the skin, breaking skin. And so hormone replacement therapy may not be suitable, but local estrogen is. And that's why even if someone said to a patient in the past, you can't have hormones, I would always say revisit the conversation and ask about systemic versus local hormones. Revisit the conversation, what else have you tried? And often when you give people strategies of other symptom management tools that may be non-hormonal, they may not need the hormone replacement therapy. But if people think that's the only option they have, of course, many people are going to wonder, is HRT the only thing that is going to help me?
Sure. And you talk a lot about self-advocacy, and you touched it right now when you were giving those practical ideas of how to implement. I think it's something every patient and survivor can relate to. What does self-advocacy mean to you, especially for women navigating post-treatment life?
So currently, and I think sadly, people need to self-advocate to get the help because healthcare teams aren't making the menopause and hormonal health conversations part of cancer treatment conversations. So people find out themselves, they have all of these symptoms. They think, oh my gosh, is this now the menopause? Is my treatment made me menopausal? What do I do about those symptoms? It shouldn't be that way. But at the moment, self-advocacy means putting your elbows out a little bit and becoming a little bit of a difficult patient. And I don't mean the angry patient or the patient that is rude. I don't mean anything like that. To me, the difficult patient is almost like someone who dares to ask twice, who might want to ask for a second opinion, who might want to seek specialist help, and who might want to think, okay, hang on a minute, what can I do? What are my treatment options? What can my doctor do for me? And what can I do for myself? And putting all of that together takes energy, is a little bit of hard work. You need a bit of a headspace, and you need to put your elbows out as well. But The benefit about it is it makes people feel really empowered, because once they realize they have many options, they then often want to share that with others. And so it's like this whole, and it's beautiful what's happened over the last few years. It's this whole community that is gathering across the whole world thinking, me too, I had this cancer, I had that cancer, I'm in menopause too, I'm too young, this has helped me, that's helped me. And so there is a whole group, and it's like a collective social impact, really. And that has a really positive impact on people's health and also their health outcomes. Um, I hope in the future people won't have to self-advocate so much. And if everyone does a little bit, healthcare professionals bring it into the conversation more, patients talk more about what they're experiencing, it can be a togetherness rather than people feeling they haven't had the support and they have to do it all by themselves.
Well, I hope so too. And as you spoke about the community, we see that this is a big impactful help to other patients and to in every cancer type. And through the also other episodes on this podcast that we have been speaking about other cancer treatments, the sense of community, it seems to be like a thing that is consistent, that we need to not feel alone, because when we feel alone, like mental health will not be will not get better, and it will be even more difficult to get through everything else. So let's move into the broader picture of the what comes next after this phase. For many people, life after treatment can feel like starting over, right? How do you help women rebuild a sense of identity when both their body and their life have changed? And I know community is part of this. So
Yeah.
I would like to take over now.
Yeah, it's really at Menopause and Cancer, we're really passionate about information and sharing evidence-based information, because especially in the menopause world, there are many myths, people do things different ways, and it's usually very much a this or that approach. It's people say you take hormones or you go the natural way, and we don't see it like that. We there is no this or that approach. There is a little bit of everything. It's often very multifaceted. Like I said earlier, people can empower themselves through lifestyle changes, reducing their stress levels, eating a healthy diet, but also maybe starting to exercise and having help and going to an exercise professional who can help, or a dietitian who can help, someone who can really help people figure out a plan. And then the other part of the plan is empowering yourself with talking to doctors and really bringing that information together. And we often feel that valuable information, evidence-based information, gives people a little bit back of their security, their safety, all of those things that cancer took away from you. And with that in return comes confidence in your body. And then also the confidence to navigate physical changes, mental changes, emotional changes. And so we build people up with information that gives people the confidence. And then often these very difficult changes in a physical body, in a mental body, are then also easier to manage.
Well, thank you so much for that perspective. I think also one important side is health literacy, and that you said that we need to question a lot our doctors and speak a lot about this. But I think also it's important to go look for evidence and be more connected to pages that are sharing this evidence-based interventions or ideas, and to keep on learning also. So this is also a big part of me, because I love learning and I love studying. So I think it could be a very important side of self-advocacy. So you feel more comfortable about your knowledge regarding everything. Um, and I wanted to ask you as we wrap up, and I'd love to leave a message for everyone that is listening. And if you could speak directly to someone who has just finished treatment and is starting to experience menopausal symptoms, what would you want them to hear?
That you have options, that you're not going to feel like this forever. Your menopausal symptoms might come and go, and they will change over time, and you are never, ever stuck. And if I was going to be here in 6 months' time with you again, you will probably feel different. You might have different symptoms, and some of your even long-term treatment plans may have changed. But when you're in it, you think you're stuck and you think nothing's ever going to change, but that's not true. And I really want to tell you this is a fluid journey. And the best thing you can do for you is keep learning and keeping your options open, because what you and your body need today might be very different to what you and your body needs in 6 months' time or in a year's time. So keep your options open and serve you and yourself with what you need today. A great starting point is to make yourself a really nice cup of tea or a coffee and sit down. On our website, we have a free menopause symptom checker, and it's just a PDF. And it lists all of the menopausal symptoms, and it's quite a nice ritual to just sit down and think, what is it that you're even experiencing? And don't worry if you don't know, is this the menopause? Is it chemo brain? Is it brain fog? Don't worry, just put it all down. How much are these symptoms affecting you? Do they keep you up every night, or is it once a week? Can you still walk, or does your joint ache get better? Like, be really clear about what it is that you're experiencing, and then take that to your next doctor's appointment. That's often a really good starting point, because when people first come to us, they're a little bit confused and all over the place. And just by sitting down and filling in the symptom checker can really help you have a more informed conversation when you see a healthcare professional.
Such a powerful note to finish on. Thank you so much, Dani. Thank you for sharing your insights, your honesty, and your heart with us today. It was amazing to hear from you.
Thank you so much for having me. A few years ago, not in a million years, would I have thought to have a conversation with such a brilliant organization like yourselves and put the menopause on their radar. I literally had to go and beg people to listen to me. And now to be invited to your show, it just means how more and more people really want that information, how more and more people want to learn. And so thank you for helping us spread the word.
Of course, and thank you so much for your availability. It was very nice to have you and to connect with you. So let's hope for future collaborations also. And thank you for everyone that is joining us at this episode on the Oncology Revolution. And if you found this conversation meaningful, please share it. It's worth listening to and it's worth sharing. So thank you so much for being here.